I've been at Sturdy for about a year now. I started in January 2022, and prior to this, I was in a similar position in upstate New York. And in that position, we had an interesting relationship. Some of our network hospitals in the area had developed a peer support program where five hospital systems together kind of got together and decided, hey, we're going to all kind of do this peer support system together. They had volunteer physicians, nurse practitioner, nursing staff. And in each category, if somebody needed peer support, they would be assigned somebody anonymously from a different hospital system. And each hospital system also had their volunteers. And it was a really fantastic system. When I came to Massachusetts, at Sturdy, we did not have a system in place. And in talking to several physicians and providers that spoke about burnout, they had to reach out to their chiefs and they had to reach out to the CMO, but that wasn't necessarily the best process because one, it was not anonymous, and two, you had physicians that they were directly reporting to also kind of learning that they were having a lot of hardship, and they didn't feel like they could be as upfront and honest as they wanted to be. We kind of explored as a Sturdy as a system, creating a peer support program ourselves. But being a relatively smaller health system, it's a little difficult because everybody tends to know people. And so if you get paired up with somebody that you know well, again, I think there's a difficulty with being completely upfront. And so we're tremendously excited about the opportunity to work with Betsy Lehman in this project and being involved in it. And our providers were too, not only to have that kind of peer support network to rely on, but also to be volunteers and to be peer supporters themselves and get trained.